my name is Katie. I'm going to be discussing an NPR article that talks about just one of the crises that has to do with the COVID-19 pandemic. The article discusses a 40-year-old female who was diagnosed with metastatic breast cancer. She refers to herself as Childress. She had gone through 8 months of aggressive chemotherapy in hopes of reducing the size of her tumors so that she could get a mastectomy. When she had gotten to the point where her tumors were small enough so that they could go ahead with the procedure, COVID-19 broke out, and they were only doing essential surgeries. She needed a second part to her surgery called the flap procedure, and unfortunately this part that was necessary for her was determined to be cosmetic and therefore non-essential, and so her surgery was canceled. She waited about 5 weeks, and on that 5th week, she started to notice the growth of her tumor. It was visible under her skin. She went back to her oncologist, and they decided to put her back onto another aggressive round of chemotherapy. The oncologist said that the earliest he would be able to get her back into surgery would be October, which we all know that there's a prediction of the second wave during the fall and the winter months. And so it's very possible that her surgery could be delayed again due to this. Unfortunately, this is just one example of hundreds of thousands of cases in America of people experiencing delays in medical treatment. The American Cancer Association released a statement saying that about 1/4 of cancer patients are having delays in their treatments. That's people with active cancer. And then that doesn't even include the people who are having new signs and symptoms, who are unable to get screenings, which can lead to a new onslaught of cases once things start opening up, which can again over impact the system and create ineffective healthcare for those patients. Dr. Parikh, I think is how you say it, is an oncologist at the University of Pennsylvania, and he said that it's going to take months and possibly even years to really feel the full effects of the deferred treatments related to this COVID-19 pandemic. So I was really interested in this from a bioethics standpoint because there's clear beneficence for our COVID-19 patients. We're trying to do our best to cope with what we have and give our patients who have COVID-19 the best possible outcomes, as well as try to create less exposure to the general public. But where does that leave people like Miss Silver, who have, also a chance for mortality, even though it may be longer down the line? Is the delay in her treatment going to lead to more metastasis? If the regrowth of a tumor could then go and metastasize, and the cancer then becomes not treatable and the patient is determined to be terminal, which is a very real possibility for a lot of these cases, if we have the ability to remove that tumor, don't you think that those people deserve just as much health care as the current COVID patients? One could argue that the delay in her treatment, we could then contribute or attribute her death to COVID because she was definitely a bystander of it. And there's definitely argument that there's a lack of justice and beneficence for Miss Silvers or people like Miss Silver, who were denied the most effective treatment, and others being put first. So that would be the COVID-19 patients right now. Provision 3 of the Code of Ethics for Nurses details that our responsibility is to advocate and promote the health and safety and rights of our patients. It's super important that as healthcare providers, we understand the crisis that we're being affected by right now with COVID-19, but we also have a duty to these other patients to continue care for them. And to also make sure that we're advocating for proper treatment, and understanding the risks of a delay in treatment is something that is essential to us as healthcare providers. And so if a patient can't get a prescribed treatment, it's definitely a direct threat to their health, and it's something that needs to be looked at and corrected. Provision 8 of the Code of Ethics for Nurses mandates that nurses collaborate with other healthcare professionals and in the public in promoting community, national, and international efforts to meet healthcare needs. The healthcare community, we all need to be able to come together to collaborate to find ways to knock down some of these unforeseen barriers and adequately and benevolently promote the healthcare of all of our patients during this